Better write this one out in the closet.
Member Amanda Anderson from St. Catharines Southern and Opposition Spokesperson on Industry, Competitiveness and Global Logistics.
Due to the lack of prominence with Jamaican Sign Language, there are barriers to communications with family members and public service workers. This lack of efficient communication negatively impacts the mental health of our deaf youth. The team from the Jamaica Deaf Youth Advocacy assisted with my research and found that 18 out of 19 of our deaf youth suffer from mental health issues due to lack of support. This is only natural as the Jamaican society is not equipped to aid with members from the disability community, especially the deaf community. Madam Speaker, we see evidence of this with the educational programs that are broadcast during the COVID period. We are visual learners, and yet even the visual medium such as television do not make provision for the deaf community. There is no Jamaican Sign Language, and so we cannot engage in an efficient manner. Let me attempt to show you how this inaccessibility can lead to mental health issues. Madam Speaker, I want you to close your eyes and imagine yourself at home. Your family is there, but they are all speaking in Spanish and you only speak English. You try to communicate, but they don't understand you, and you don't understand them. 1 week passes, 2 weeks, 3 weeks. By the 4th week, I am sure you must be going out of your mind, being locked up with those people who you can't communicate with. Can you imagine that awful feeling? This is exactly what the deaf community undergoes every day. This continuous pressure and frustration is no doubt a major cause to the astronomical level of mental health issues in the community. Madam Speaker, this is how I propose we solve this mammoth issue. First, all essential and public service workers should receive formal training and experience with Jamaican Sign Language. This will allow for quick communications in times of crisis or need, which in turn will alleviate the frustration faced by the community when requesting the help they need. This policy will further improve the mental health of the community by providing a peace of mind that there is an appreciation and understanding for them. That in time of crisis, they will not have to fear something as fundamental as communication. Secondly, I propose that we implement the Jamaican Sign Language as a subject in schools with proficiency ranging from levels 1 to 4 by introducing the basic level of the language at a young age and having the proficiency increase in accordance to age and scholastic level. We will be able to organically over time produce a society not only versed in Jamaican Sign Language, but with a deeper appreciation for the deaf community. The benefit of this is clear. The mental health issue caused by isolation and the lack of communication faced by the deaf community will, over time, organically and naturally dissipate. Schools will produce doctors, psychologists, emergency technicians who are able to efficiently communicate with the deaf, thereby eliminates the barrier to communication that currently exists.